It's Care Providers of Minnesota's The Inside Scoop, featuring your advocacy team, Patty Cullen, Toby Pearson, Aaron Bowie, and Todd Bergstrom. This week's host, Aaron Bowie.
Good afternoon. I'm filling in today for Toby on the Inside Scoop. I want to kick off by thanking those of you who have reached out and contacted your legislators on the various bills moving through that we have concerns with, namely the VBR cuts and the assisted living licensure bills that are moving through the process. We are starting to hear some feedback from legislators, so please keep calling if you haven't done so yet. It is important that they hear from you and how these bills are going to affect you and your operations and the seniors you serve. An update on VBR. We do not have language yet on this. A bill has not yet been introduced, so we continue to talk to legislators and the administration about our concerns with the overview that was presented in the governor's budget. Again, please contact your legislators on this if you have not yet done so, and it probably wouldn't hurt to reach out to the governor's office as well. An update on House File 90, which is the Assisted Living Licensure Consumer Rights Bill moving through the House. That was heard this week in the Government Operations Committee. It moved forward without any amendments. This bill is really the consumer advocate bill. We do have a number of concerns with it that we have circulated and do have a link to on our advocacy page as well. This is something that we are keeping an eye on and continuing to work with the author on, and we are waiting to see what the governor's office brings forward. We had seen original language and have been working with them to hopefully fix a few of the things we had concerns with in their bill, and the Senate has yet to introduce language. So we'll have a clearer picture of what we need to do and what we need to ask you to do after those other pieces of the puzzle fall into place. Another bill that is moving through the process in the House is additional funding for the Office of the Long-Term Care Ombudsman. It's something we testified in support of this week. We expect that this is something that will also be introduced and move in the Senate. It is one of the areas that everyone agreed to during the interim working groups. Finally, later today, the swing bed increase bill will be heard in the House Health and Human Services Policy Committee. We and our long-term care imperative partners will be testifying against the bill in committee. If an expansion of swing beds is something that affects you and your operations, you should absolutely call your legislators on this. This will be moving in the House, and the Senate is looking at doing something with it as well. We have been working with Mayo Health System to try and come up with some compromise language, but at this point have not reached any sort of compromise that we can both agree on. This is an important bill to contact your legislators on, and we have additional information on that on our webpage as well. Thank you. Sorry, I don't have more positive news this week. Hopefully in the coming weeks, as all of the bills start to come together, we'll have some more positive news to share with you. If you haven't yet registered for Day at the Capitol, please do so. This year, it's probably more important than ever that you show up and have an in-person meeting with your legislator. If you can't make it up, please be on the phone with them, invite them out to your community to tour and show them the good work that you do. Thanks and have a good weekend.